Good morning, everybody. Fortunately for New South Wales, our vaccination rates keep increasing. However, there has been a slight slowdown, so we encourage everybody to come forward and get vaccinated. We have 46.2% double-dosed adults in New South Wales, or 16 and over, which is great, and 78.5% who have received their first dose. And obviously it's when that 46.2% number gets to 70% double dose that we can look forward to those freedoms that we announced recently in our roadmap. To 8 p.m. last night, there were 1,257 cases of community transmission and regrettably 7 deaths, and we extend our deepest and heartfelt condolences to the family and loved ones of all those who died overnight. Can I stress a number of key points today? Firstly, southwestern Sydney and western Sydney remain our areas of concern in Greater Sydney area. However, we are seeing a stabilisation in some local government areas of concern, and that's positive. We hope that continues. However, we have seen also an increase in cases, as we mentioned yesterday and the day before, in the inner Sydney areas of Glebe and Redfern, and we ask communities in those areas to please come forward and get vaccinated, but also to make sure they're sticking to the COVID restrictions. And again, in regional New South Wales, we have seen a stabilisation in cases. However, in Hunter, the Central Coast, and Wollongong, we've seen an increase in cases. And Dr. McAnulty will also talk about sewage detection in some communities where there isn't currently any cases. And we ask those communities to come forward and get tested and to make sure they get vaccinated. But I want to leave a really key message today, and that is do not let your guard down. Today there has been some easing of restrictions after we passed that 6 million jab number, but it's way too early for any of us to get complacent, and we are concerned that an unexpected event, a super spreader event, can suddenly have a major setback. And so whilst people start enjoying some things they couldn't enjoy last week, I urge the community, please do not get complacent. Do not let your guard down, because any event that we don't anticipate or expect could see a major setback, and none of us want to see that happen. I also want to make this very important point, that obviously once we get to 70% double dose vaccination, we've outlined the freedoms that exist for vaccinated people. However, don't assume that at 80% double dose vaccination that unvaccinated people are going to have all those freedoms. I want to make that point very clear. The government is yet to finalise its plans in relation to what happens at 80% double dose. And our key message is come forward and get vaccinated, because once we start opening up at 70% double dose vaccination, the higher the rate of adult coverage of people 16 and over that are vaccinated, the better it is for all of us. Now, currently that figure is at 78.5%. By the time we start opening up, we would like to see that figure at 85% or even closer to 90%. Now, that is our hope, because that gives that extra level of protection, because there is no doubt that once we start reopening, those that are unvaccinated are especially vulnerable. So I'm appealing to all of you, to everybody, to make sure in your circle of friends or family, if you know of anybody that's unvaccinated, please make sure they come forward and get vaccinated. Importantly, for those aged 16 years and over, Pfizer is now available, as we know. Young adult or 16 to 18-year-olds can only accept Pfizer. Pfizer is now available from GPs across the state, which is positive news. And in fact, we want to encourage all those Year 12 students and Year 11 students who are eligible to come forward and get vaccinated, to give that extra bit of protection for older adolescents and younger adults. But we also want to make sure that everybody is clear that from today and next week, for 12 to 15-year-olds, Pfizer is available at GPs, and from next week, Moderna will be available at pharmacists for young children aged between 12 and 15. So we really want parents to take up this opportunity to vaccinate their children, so that by the time we go back to school, not only will we have high vaccination coverage for adults, but we'll also start to see some vaccination coverage for 12 to 15-year-olds as an additional safeguard. So these are additional safeguards that we want our community to have by the time we start reopening. But I want to stress again, for those of you who choose not to be vaccinated, that's your choice, but don't expect to do everything that vaccinated people do, even when we hit 80%, and I want to make that very clear. Our strong message today from the public health team, from myself and the New South Wales government, is come forward and get vaccinated, because all of us fear what will happen to those around us who aren't vaccinated, but also please think about our hospital staff and those that have to take care of people with COVID. We want to protect them as much as we protect each other and our loved ones. And the hospital system will come under increasing stress once we start opening up if there are too many people that are unvaccinated. And again, on that point, I want to stress that as our state moves towards those higher vaccination rates, as we see some communities in Western Sydney, for example, get vaccination rates to around first dose 89-90%, which is outstanding, that means that there are pockets of our community which are well below the state average. And today I want to welcome Danielle Austin, who's at St Vincent's Hospital. She's one of the wonderful registered nurses there, and she's in charge of managing the vaccination program for that hospital, but also in managing the mobile vaccination van that goes out to support vulnerable people in our community to ensure that we have outreach programs as well as just in-reach programs to cover off anyone vulnerable in the community. And finally, I just want to again say to everybody that as we approach those targets, all of us can be hopeful. But our reopening is based on the premise that all of us are responsible, safe and cautious during this time. All of us are looking forward to doing those things we can't currently do, but all of us will move together safely and cautiously, respecting the health orders and appreciating that whilst ever people remain unvaccinated, they remain more vulnerable and more susceptible to the ravages of this very serious illness. I'll ask Dr McAnulty now to give his update, then Danielle Austin will explain to us the important outreach program for vulnerable communities as an example of how we need everybody to catch up to the state average to make sure there aren't pockets of unvaccinated people who are vulnerable, and then we'll take your questions. Thank you.
Thanks very much, Premier, and good morning, everyone. Just wanted to take you through the numbers from for yesterday. There are a total of 1,257 locally acquired cases of COVID reported to 8 o'clock last night, and there are 3 overseas acquired cases reported in the same period. There were 137,668 COVID tests reported yesterday, compared to 105,505 the day before. We have currently 1,189 people in hospital admitted with COVID. 222 people are in intensive care, 94 of whom require ventilation. Sadly, as the Premier mentioned, we've seen the deaths of 7 people yesterday. A man in his 90s from Dubbo who died at St Mary's Villa aged care facility, where he acquired the infection, who was vaccinated and had underlying health conditions. A man in his 80s from Sydney's inner city died at St Vincent's Hospital. He was not vaccinated and had underlying health conditions. A woman in her 60s from southwestern Sydney died at Campbelltown Hospital. She was not vaccinated. A man in his 80s died at Nepean Hospital. He acquired his infection at the Hawkesbury Living Aged Care Facility in Sydney's northwest. And it's the second death sadly linked to this outbreak at this facility. He was vaccinated and had significant underlying health conditions. A man in his 90s from southwestern Sydney who died at Liverpool Hospital. He was vaccinated and had underlying health conditions. A woman in her 90s from South Sydney's inner west who died at Concord Hospital. Was not vaccinated and had underlying health conditions. And a man in his 80s from southwestern Sydney who died at Sutherland Hospital. Who was vaccinated and had multiple underlying health conditions. We'd really like to express our deepest sympathies to the families and friends of these people who sadly died. There have now been 184 COVID-19 related deaths in New South Wales since the 16th of June 2021 and 240 deaths since the beginning of the pandemic. We've had a number of sewage detections identified in recent days in places where we have no known cases, so we're really urging people in these areas to come forward for testing if you have even the mildest of symptoms. And these are at Yass and Eden in the southern part of New South Wales, in Tamworth in the Hunter New England, in Dunbogan and Karua on the mid-north coast, in Jiroa at Illawarra Shoalhaven, and Brooklyn in northern Sydney. So please, if you live in those communities or have been in those communities, come forward for testing right away with even the mildest of symptoms. Where the suburbs we're seeing most cases in at the moment continue to be in Sydney's west and southwest, notably Greenacre, Auburn, Yagoona, Liverpool, Punchbowl, Guildford, but also Redfern, Bankstown, Condell Park and Busby. So we're seeing increasing cases in the inner city, Redfern, Waterloo and so on. So we're really urging people that are living in these suburbs as well as everywhere else, but particularly if you're in one of these suburbs with high levels of cases, please make sure that you're coming forward for vaccination and make sure your family and friends are as well. Vaccination is our key to getting out of this. In Western New South Wales, we've had 12 cases of COVID reported yesterday, bringing the total number in the LHD, the local health district, to 978. Yesterday's numbers included 5 in Bathurst, 4 in Dubbo, 2 in Burke, and 1 in Walgett. There's an outbreak going on in Walgett, and we're concerned that people who have been in Walgett or live in nearby communities where there might have been contacts travelling to and from Walgett to be particularly vigilant and come forward for testing, particularly concerned about Coonamble, and we've seen a call out for people to get tested in Coonamble just in case they've been exposed to the virus. Please come forward for testing if you live in those areas. In the far west, we've had 7 cases reported yesterday, with 4 in Broken Hill and 3 in Wilcannia. As the Premier mentioned, we've seen an upswing in cases in the Illawarra, Shoalhaven area, as well as in the Central Coast and Hunter areas over the weekend. So we're very concerned that people really need to hear those messages about getting tested, being alert for symptoms, maintain the COVID safe practices, and importantly, get a vaccine if you haven't already got one. Thanks very much.
Good morning. Thank you, Premier. So since February of this year, we've administered well over 8 million COVID vaccinations in New South Wales, and another milestone was achieved this morning. We opened our doors to children aged 12 years and over at our hub, and I can tell you it was a delightful thing to see those children in our queue at the hub this morning. As part of the statewide vaccination program, St Vincent's Hospital vaccination team has been working tirelessly over these months to ensure equitable access to vaccinations for vulnerable populations across our broader community. Last year, our homeless health, mental health and alcohol and drug, disability and aged care services identified the exceptional risk these population groups faced under the threat of COVID. And we saw firsthand the devastating impact on residents and their families when COVID took hold in facilities. We knew that providing vaccinations was the only way to ensure the ongoing safety of our patients who bear additional risks with COVID. Nearly 5 months ago, and I'm so proud of this, we opened our first targeted homeless health and social housing hub down in Woolloomooloo in partnership with St Vincent de Paul, Kirkton Road Centre, the City of Sydney and specialist homeless health services from across the local area. And since then, we've provided more than 5,000 vaccinations to those who are most vulnerable in our community. And I have to say, it's one of the greatest achievements I think I can stand here and talk about from a personal perspective. Our Vinnie's Vax Van was an idea born from a conversation held at this hub. When vaccine hesitancy was at its peak across the broader community, this hub saw people turning up in their hundreds week in and week out because they knew that vaccination was the only way to keep themselves, their loved ones and their community safe. And so we knew that there was appetite out there for people to receive COVID vaccinations. But we knew that not everybody was going to be able to access vaccinations through our standard mass vaccination hubs and other clinics. And whether that was reasons of cultural and linguistic difference, whether that was due to poor mobility, physical disability, chronic health conditions, or people who aren't able to leave their houses, we knew that we needed to reach them instead. I was very fortunate to be able to reach out to the Curran Foundation and the Suttons family, who very quickly supported the idea, understood the importance of this work and provided us with our first Vax van, which has now been extended to 2 Vax vans. We've travelled across Greater Sydney, vaccinating residents and staff in residential aged care facilities, young people with severe disabilities and supported accommodation and their carers, people who are bedbound and unable to leave their homes, along with their families who have lived with the fear of passing COVID on to their vulnerable loved ones. We've provided vaccinations through hubs and from our Vax van for people living in temporary accommodation and hostels, those people who have been further isolated throughout this pandemic. And we've been able to respond to areas of concern at short notice, including deploying teams into Parkley Prison to administer vaccinations to inmates and staff there. Are we unique? Not at all. I stand here representing the thousands of people who are out there in our vaccination programs across the state who are doing everything they can to rapidly protect our broader community. Why? Because we know that vaccination is the only way out of this. It is the light at the end of the tunnel. And especially for my colleagues who are on the floor day and night at the moment dealing with the ravages of COVID as it affects more and more people across our community, we are working relentlessly at the other end of the spectrum trying to protect those who are in our community, but also to protect our colleagues who are working on the front lines. And there are thousands of us working across the vaccination program, and I wanted to give a quick shout out to them because it's not just the doctors and nurses, it's the pharmacists, it's the techs, it's the IT support, it's the cleaners, it's the wayfinders, it's security. There are literally thousands of your New South Wales compatriots out there working hard to keep the community safe. And this vaccination program is so immensely complex and relies on so many moving parts, all of them people. And all of them people who want that light at the end of the tunnel to get closer and brighter every single day. So for everyone out there watching who hasn't been vaccinated, I cannot ask you strongly enough to please reach out to your primary healthcare provider and have discussions if you have concerns about vaccination. Reach out to your local health centres. Reach out through New South Wales Health website, the New South Wales Government website, Health Direct, to make your vaccination appointment. Come down and see us at our pop-up clinics, our outreach clinics, all of which can be found on the New South Wales Health website. If you are having difficulty accessing a COVID vaccination for yourself or for somebody you love, please contact Health Direct so we can find you out there in the community and provide you with the protection that you deserve. And to our Aboriginal and Torres Strait Islander communities, my health colleagues and I understand the absolute urgency with which we need to provide you with that protection. So this week, and as part of our ongoing commitment to protecting all of our communities, we are holding specific pop-up clinics across the state for Aboriginal and Torres Strait Islander people aged 12 years and over. For everyone else, my final comment is please get vaccinated, please be part of the solution, and please help end this pandemic as quickly as possible. Thank you.
Danielle. Premier, can we just ask quickly, the fact that you're here today, have you had a change of heart? Are you back to doing daily conferences now?
No, I was always scheduled to do today because of the key milestones we announced. Obviously today is the first day. Many people have freedoms they didn't have before. And I want to stress that nothing has changed from my comments from last week. I'm on the job 24/7. In addition to managing the pandemic, we manage the state moving forward, and I'm always available, but I won't necessarily be here every day at 11 a.m. Some weeks I might be here every day, other weeks I might be here intermittently, but the important thing to note is that your government is not only on the job 24/7, but we're also making sure that we provide timely information when we need to in the way that we need to do that. And I think the public understands that.
I mean, you mentioned pockets of suburbs where you're concerned that vaccine rates are lagging behind and they're going to be left behind. Which specifically, what areas are you worried about?
It's interesting to know that the City of Sydney itself has below average vaccination rates, and we've seen now how there are pockets of vulnerability, and so that is one local government area I'd call out compared to others. And there are also pockets in the regions, but fortunately we've identified where those pockets are and held walk-up clinics over a weekend and then seen numbers boosted. In some regional rural communities where they've got smaller numbers in their township, obviously we can get those rates up very quickly. So there are pockets across the state, and this information is publicly available every day. So you can actually track on a daily basis what each local area is, how every local government area is tracking across the state. We've made this information publicly available. The federal government's data is inputted into that, so it's current. We want to make sure that when we do start opening up at 70% double dose, that we don't leave people behind, that we use the time now until that time. We hope that time will be around mid-October when we start opening up. But ahead of that, we want to make sure we've covered everybody, because we don't want anybody who wants the vaccine not to have access to the vaccine. And can I therefore thank thousands of nurses and healthcare professionals like Danielle, who's here today, who are supporting us in doing that, not just in managing the hubs that we formally organise, but also formally going out to these outreach areas, to these more difficult areas, I should say, to make sure that nobody who wants the vaccine is denied access. And we're working with the supplies we have as best we can. And today is also a very important day. We're actually saying to parents, if you have a child that's above 12 years of age, please consider their vaccination options. By the time schools open up on the 25th of October, it would bring us great joy not only to have a huge rate of first dose adults covered, way ahead of the 70%, but also to have a number of children between the ages of 12 to 15 vaccinated as well.
Premier, if I could ask about the LGAs.
I'll come back in a second. Yep, sorry.
The Deputy was on the radio this morning saying when we get to 80%, the unvaccinated will have the same level of freedoms. You're saying something else this morning.
I'm saying the government, thank you for that question. The government has not yet confirmed what will occur at 80% double dose vaccination. We're still working on those plans. I don't want people to think they can sit back, let everybody else do the hard work, and then turn up when it's 80% and get everything else that vaccinated people are. That is not the right message. I want to say very clearly that if you're not vaccinated, you will not have the freedom or the freedoms that vaccinated people have, even when we get to 80% double dose. And it won't only be government decision. A private business might choose only to welcome patrons who are vaccinated. An airline might say you can only fly with us if you're vaccinated. So I just want to thank everybody, and I know lots of people, even in my own circle, as all of you would, who are hesitant or couldn't be bothered getting the vaccine, but everyone now is really sitting up and noticing and saying, I don't want to miss out, I want to keep my family safe, I want to keep great health workers like Danielle and her colleagues safe. And I just want to thank people, especially those who've had a change in heart, and we know that's occurred because the rates of vaccination continue to go up. But I don't want people to think, oh, I'll sit back, not get vaccinated, and then just wait and then let others do the hard work and then get everything that everybody else is getting. That is not the right message.
Just one quick follow-up. In terms of a timeline for when the unvaccinated will get those same level of freedoms, would it be 6 months, 12 months after we hit 80%? What are you guys thinking?
Well, it might not even be a decision for government. As I said, private businesses, private organisations may make the decision that they don't want to welcome unvaccinated people. And we're seeing in places across Europe and North America where private businesses, private entities are taking matters into their own hand, and that's their prerogative. People who want not only the safety of their staff and the safety of their patrons, but also for business continuity reasons. Because obviously an outbreak of a case in any particular location at any time might mean that business has to shut its doors for a period of time. And that is a business risk as well as a health risk. So I just want to send the very strong message that don't assume you'll get everything that vaccinated people get at 80%. We've not yet prepared our planning around the 80% roadmap. What we've presented to the public and the community is our plans for the 70% double dose roadmap. But I want to make very clear, at 80% double dose, our expectation is that those that are vaccinated will enjoy overseas travel, will welcome home we'll start welcoming home fully vaccinated Australians coming through Sydney Airport. But don't assume you can sit back and by choice participate in everything. They will be decisions for government based on the health advice, but some of those things will be decisions of private business.
Sorry, just on the government requirement to be vaccinated. So John Barilaro said that the requirement to be vaccinated to go to the pub won't be permanent. Is that right?
Look, we've not yet put out our plans for 80%. We're still formalising them. We've not received health input. We've not yet determined those plans. Obviously, the national plan is a guide to what can happen at 80% double dose, and that is always our guide as well. But we want to be clear that there'll always be things, and not just because of government decision, but it might be, government might say it's up to business to decide whether or not they accept unvaccinated patrons, or government might decide what freedoms can exist for people, but we've not come to those conclusions yet. So I don't want people to think they can sit back and let everybody else do the hard work. And if people are concerned, if people are worried about getting vaccinated, as we've said, please contact your GP, please speak to your local pharmacist or a healthcare professional. But we all have choices, and if it's your choice not to be vaccinated, we'll that might mean you cannot participate in things that fully vaccinated people do. I promised I'd ask you the next question.
Just on the LGAs of concern, thanks Premier. If Redfern and these inner city suburbs are such a concern now, why are they not LGAs of concern? When are we going to see some movement in terms of lifting and restricting LGAs of concern, considering that also these areas, you mentioned that they have lower vaccination rates?
Yeah, well, all those factors are based on the health.
You mentioned that they have lower vaccination rates.
Yeah, well, all those factors are based on the health advice. So we react to the health advice, and when we call out areas of concern, it could mean that we're worried. In the inner city areas, we're especially worried because it's vulnerable communities, and we don't want it spreading very quickly through especially vulnerable communities that still remain unvaccinated. And that's why the work of Danielle and her colleagues at St Vincent's and other hospitals as well in outreach in vulnerable communities is so critical. We don't want to see people who often might be marginalised or not have access to the same things we have access to, be at a huge risk to their own health and safety because they don't have access to the vaccine. So it's a number of factors which health will give us advice on what comes in and out of local government areas of concern. And believe me, I would love to be in a position where we could proactively announce areas that are no longer areas of concern. And the glimmers of hope are there. There is some stabilisation in key local government areas which have been had the highest number of cases. We suspect and hope, fingers crossed, that it's because the vaccine rate is starting to kick in. But we can't tell yet, it's too early. We need to at least get to the end of this week before we can make any of those conclusions. But what is really important for us is, as all our health professionals say, the higher vaccination rates will help stop the spread, reduce the likelihood of high cases when we open up at 70%, and allow all of us to enjoy, who are fully vaccinated, to enjoy those freedoms.
Exercise in the LGAs of concern in West and South Western Sydney. Can a plan be made to, for example, open public pools in Western and South Western Sydney? Because as we saw at the weekend, there's a pretty big disparity between someone who lives 5 k's from the beach and can go there and someone who, may live 5 k's from a pool that's closed. Can you open pools in South Western and Western Sydney?
Look, unfortunately, there are a lot of decisions that are very difficult to take.
The bars is open in the West. Can you do the same in Western Sydney?
Look, there are very difficult decisions we have to take. There are waterways all across Greater Sydney, all across parts of Sydney. In addition to beaches, there are riverfronts and other waterways, but we have to take the health advice, especially until we get to the 70% double dose, as difficult as it is. Because even at 70% double dose, those who have not had any doses of vaccine remain vulnerable. And we want to make sure our priority is to give vaccine to everybody who wants it before we start opening up, because we don't want anybody left behind. And that's why, especially today, given it's the first day, we've had some relaxation, not a lot, but some relaxation across Greater Sydney and parts of regional New South Wales. The message is there as well. In some communities where restrictions have been lifted today and people are starting to go about their business, we can't allow complacency to creep in. We've seen what the ravaging effects of this virus is, how contagious it is. And as much as I would love to, I can tell you nothing would give me more joy than relieving the stress and pressure families are under, individuals are under. Most of us in this room go to work and don't have the same pressures that people at home who can't go to work, who have to homeschool, and who've got those challenges. I can't imagine what that's like. And all of us are missing our families. And hopefully today there'll be a bit of relief for people, but it's way too soon to say that we're okay and to sit back. And that's why my strongest message today, and Dr. McAnulty is the same, as is Danielle, is do not be complacent. Do not just sit back and think it's okay. Now that we've got the roadmap, we can relax. No, the roadmap is very positive. I'm looking forward to us being able to open up and provide those freedoms. But it means that until that time, all of us have to stay the course. All of us have to appreciate that models and predictions and case numbers and hospitalisation rates are only dependent on all of us. So the modelling gives us a guide. We know what our hospital system can and can't cope with, but it's easy to say that when you're not a nurse or not a doctor or not somebody who works in the hospitals dealing with this deadly virus day in and day out. So we always have to think of our special people that work in our hospital system, our ambulance workers, our emergency service workers, our paramedics. They will keep us going when we know, unfortunately, that because of the lag in time, that there'll be more hospitalisations and more people fighting for their lives. Who hasn't asked a question? Sorry, yeah.
Just tell me, now the 12 to 15-year-olds can be vaccinated, can you confirm that they'll be counted separately so they don't artificially inflate the 70-80%?
Absolutely, yes. So when we talk about the 70% double dose or the 80% double dose, we're talking about what the Doherty plan defines as adults, and for the purposes of the Doherty plan, they define 16 and over as adults. So that's why if we can vaccinate as many 12 to 15-year-olds as possible, that gives us an extra buffer. So what we'd love to see by the time we get to 70% double dose vaccination is to see the first dose rate among 16 and over people or adults at least around 85 to 90%. That would be fantastic, because then we'd know that even if you hadn't been double dose vaccinated, you're on the way, and that there's that extra coverage. Plus it would be an extra bonus to have a proportion of 12 to 15-year-olds vaccinated as well. So just to be clear, the 12 to 15-year-olds aren't included. That's a separate count, and that's because of the work the Doherty plan has provided us. That's because of the research our health experts have inputted into that plan. And so I just want to be very clear that we don't count 12 to 15-year-olds in that dose rate. But as Dr. McAnulty from last week, said to us last week, Professor McCartney, I should say, from Westmead, who's an expert in children's immunology and children's disease, said the best support we can give children is having high rates of adult coverage. But of course, vaccinating 12 to 15-year-olds gives that next level of coverage as well.
Can I ask a question about the contact tracers here in Sydney? Insiders are telling us that unless there is a case that's in a prison or a hospital or an aged care home, they're simply just not investigating at all, and because they're simply overwhelmed. Is that correct? I might ask Dr. McAnulty to answer that question. Thank you.
Thanks. So as the number of cases has escalated, we have honed how we do our risk assessments and how we follow up cases and contacts. And so as we alerted many days ago, we've focusing with the experience we've had over the last 18 months, we've been able to identify those places at a higher risk values, higher risk for COVID transmission, and those at a less risk of COVID transmission. So we have taken the deliberate decision to prioritise locations such as workplaces, high-risk settings such as prisons, aged care facilities, hospitals, where we know that there is an increased risk of transmission, or places where we've identified transmission. In addition, we in regional areas, we maintain, where there are a few cases, we continue to follow up even lower risk areas, just because we want to make sure there's just no transmission at all in those areas. So we do take a deliberate decision. We reassess on a regular basis the way we're doing contact tracing in case follow-up, and we've initiated a number of new innovations to try and get the message out to the escalating number of cases over the last few weeks, quickly through text messaging about what they need to do, the cases need to do, and what their close contacts need to do in terms of isolation and getting tested. So we're adapting as we see a change in case numbers and a change in the profile of the cases and contacts. Our public health units and contact tracers and case interviewers and epidemiologists are working tirelessly around the clock to make sure that we're getting to the people we need to get to as soon as we can.
But is it correct, Doctor, that most businesses are now having to do their own contact tracing, essentially?
So we're working with businesses, and we've been doing that for many weeks now, to help them develop plans, guided by guidance we have and provided with additional advice, to make sure, because the businesses are often in the best place to know how their systems work, who is most at risk, how they can organise their businesses through their pre-existing COVID plans to identify who's most at risk and how they can keep their business going. So we are very concerned about those critical businesses, food distribution, critical infrastructure that needs to keep going to make sure that the community can keep functioning. We are still seeing transmission in workplaces, such as I mentioned, and so it's important that we work with those businesses to continue them to function where they can.
And just to follow up to your concerns about the inner city, Glebe, Waterloo, etc., follow up to that question earlier about what is the trigger point, do you think, Dr. McAnulty, for you to declare those areas of concern, lock them down the same as the 12 existing ones?
So we have a continuous process every day looking at the numbers of cases across the state, including in areas of concern. But LGAs regardless of whether they're in the area of concern or not. And we look at case numbers, but also the other factors that might influence whether or not additional measures are useful. So we'll continue to do that. We'll continue to do that. But over the weekend, we've seen this increase in cases.
Are they close to being locked down?
Well, we'll assess that as we do every day, and we look at a range of factors. So that's always on the cards, but we need to make sure we're making the right decisions at the right time.
Premier, the ambulance service has said that they're getting ready to call up firefighters who have basic first aid training in the case that the system is overwhelmed when those hospitalisations peak. The HSU says that's not very useful. They'd rather the states look to other states, ask if they can send over some paramedics similar to what we do during bushfires. Is that a conversation that you've had with other state premiers, and is borders the barrier to that happening?
Well, our obviously, as we've said, we anticipate that October is likely to be the time when the hospital system comes under the most pressure, when you have the accumulation of cases, and as people develop serious illness in the second week of their illness is when we'll see the rates of intensive care in particular go up. As Dr. Nguyen presented a couple of weeks ago, she is one of the many experts across the state that have informed what we need to do to make sure we reach those surge capacity, or what we need to do to make sure we take care of not just whoever presents to intensive care, but also to make sure we keep our hospital system running given the number of COVID patients we'll have at that point. So our decisions around ambulance care, and as Commissioner Morgan was here the other day, who heads up the New South Wales Ambulance Service, the paramedics, our emergency service workers, our hospital system is one network dealing with the pandemic, and all of our plans, which were explained in some detail a few weeks ago, were informed by the specialists. So I appreciate people might have a lot of input and a lot of views. I understand that the clinicians consulted during the course of putting the plan together. They've been working on it since about March last year, March 2020. So that plan has been informed by specialists, by intensivists, by people in emergency care, and also, of course, by epidemiologists. And those practices have obviously already started to take place, and perhaps Danielle can even speak in a more informed way about what happens at her hospital when dealing with the extra number of patients. But all those plans have already been put in place. There are contingencies around those plans.
So having a discussion with other states about them potentially sending paramedics here
that's not occurred. I've not been advised we need to do that. I've been advised that we have enough staff, even though they'll be stretched, we have enough staff that have been retrained, redeployed, and also, as we've explained, ambulance is key because they will be taking patients when they pick them up from home, perhaps not to the nearest hospital, but to the hospital they've been asked to take them to, and that's part of the plan.
Just on that question about ambulance. The ambulance service has asked the fireys to provide up to 150 staff in the event that they're completely overwhelmed by the number of cases. This isn't part of the plan that you released last week. This is separate conversations that are going on now, and the fireys are concerned that they don't have the training if they're sent out on cardiac arrest incidents to provide adequate care for these people. Are you concerned?
As I said, I'm always concerned about the pressure that's going to be put on the hospital system, but the plans we've put in place, and ordinarily you would have around 500 beds in intensive care or thereabouts. Because of the pandemic, we have surge capacity up to 1,550, and that was outlined in our plan. Now, we hope we don't use those. That doesn't include people that'll be in hospital. That's just intensive care. And the best way we can protect our staff and ambulance workers and other emergency service workers is, of course, by getting vaccinated. Now, there are contingencies around those plans which the health experts have put into place. And so, my strongest message around those plans, when our health staff are stretched, when our wonderful nurses and doctors and other clinicians, therapists, physiotherapists in particular, because COVID requires a special type of rehabilitation, even in intensive care, all of our great workers understand the plans, know what's going on, but my strongest message to the public is please prepare yourselves for watching things happen a bit differently. So what we're used to will look a bit differently during a pandemic. So if you rang an ambulance and expected to go go to the closest hospital to you, that may not occur. You might have multiple family members at different hospitals. But that is all part of the plan, because we're not living in usual circumstances. Our system will be stretched, and that's why to protect all of our health workers, to protect your loved ones, the best way to put less pressure on the hospital system is to get vaccinated. And this is why I want to be very clear at what will happen at 80% once the government determines what our 80% roadmap looks like. We can never ever put so much pressure on our hospital system that not everybody who needs care gets the care, and that's what we always watch. I've always said the two most important figures that we need to keep an eye on are the vaccination rate, because that gives us an indication of who we're protecting and how we're protecting them, but then also how many patients we have in intensive care, and they're the two most critical factors moving forward. And I've always said September and October will continue to be very challenging months, as will the months after that. But September and October is the most challenging because it's when we make the transition. It's when our state starts opening up, starts getting the right balance as to what COVID normal looks like. But it also happens to be the same time. And Victoria is a bit behind us in terms of the timing. But we're hopeful that by the time we hit 70% double dose, that our case numbers are lower and that we'll be able to enjoy all those things that we haven't been able to enjoy today. But also that vaccination is key to us having even greater freedoms at 80% double dose and then beyond that as well.
Just on outdoor freedom.
Sorry?
Just on today, you waited 2 days to lock down all of Sydney after New South Wales Health discovered it had failed to control the West Hoxton super spreader event. Why did you wait 2 days, and when did you first receive advice, verbal or otherwise, that Western Sydney and Southwest Sydney should go into lockdown?
Well, I think I've answered that question many times before, as has Dr. Chant, and I think you'd all recall that day where we held 2 press conferences. It was within hours of getting advice. Sorry, can you just let me answer that question, please? So it was within hours of getting the advice, and I want to make that very clear. But as we also knew early on, is that Delta is extremely different to anything we've experienced. And I know a lot was said about when we locked down, was it too hard or too slow or too fast? But all of our major decisions have been based directly on the health advice in as short a time frame as possible, with a sense of urgency and immediacy. And you know, I say to any jurisdiction, watch what's happened overseas. Delta, for unvaccinated populations, is a horrible disease. It spreads rapidly. It denies us freedoms. I would never have assumed someone in my position would have to make the decisions we've had to make on behalf of the people of the state. There haven't been easy decisions, and we'll always make sure we don't impose burdens more than we have to on our citizens. But if it's to save thousands and thousands of lives, we've had to make those difficult decisions. And again, I think people will judge us around Christmas time when they look back to see how things have transpired, the thousands of lives we saved, and what freedoms we'll experience then, and the rate at which we've worked hard to support the federal government's vaccination program, the way New South Wales has stepped up.
You said that within hours of getting the advice to lock down. You were given a formal written advice to lock down. You say within hours.
I didn't say that.
You said within hours of getting the advice.
Yeah, I didn't say it was written
to lock
advice.
Down.
Yeah.
So it was verbal advice. Just
well,
confirming.
Advice, it doesn't matter. The advice was provided.
Hours after giving the advice to lock down. How long after Health became aware of the West Hoxton party being something that they could not control, being a super spreader advice, was the lockdown? What is that time frame between West Hoxton setting off alarm bells and the lockdown being announced?
Well, quite immediate. I mean, the health experts...
What does that mean, quite immediate?
Well, we react to the health advice as soon as we receive it. And if we were... I could have waited an extra hours or an extra day, but I chose to come back on the same day and hold another press conference, because as soon as we got upstairs, Dr. Chant provided us with additional advice, and we reacted within hours. And look, I'm sure that people will have lots to say about how this pandemic is managed, and I'll leave it to the commentators. But I will say this.
The West Hoxton party occurred on the 19th. Health knew about it on the 21st. They thought they'd found everyone. On the 24th, they realised that there were people that they didn't know were there, that had been in the community for 5 days. On the 25th, the next day, you locked down the eastern suburbs, not West Hoxton, and it wasn't until the 26th that you locked down the whole state. Why did you wait between the 24th and the 26th to lock down?
Look, these are decisions we took based on the health advice. And again, there'll be people that said we went too hard and too soon. Others will say we were, not hard enough. I mean, there are lots and lots of people who will have an opinion on this. But what is the most important advice that I receive, the government receives, is from the public health team. And we knew early on, obviously, when the health raised the issues with us, how the Delta variant was difficult. And I know with confidence, and perhaps it's a sign of immodesty, because I will defend our contact tracers and our public health team to the nth degree, because I believe we have the best public health officials in the nation, and I don't say that lightly. And I also saw how they reacted and responded to the other strains we had. And in fairness to them and to everybody involved, Delta is a game changer. And I don't know anywhere in the world, please point to me anywhere in the world where countries haven't struggled with it. The only difference for us is that we had a largely unvaccinated population when Delta hit, and that's why our public health measures have had to be so harsh. If our population had higher rates of vaccination, we wouldn't have had to have taken the measures we did. But because we had relatively low rates of vaccination, and that's why I just want to thank, for southwestern Sydney, parts of southwestern Sydney went from 19% when the outbreak first started to nearly 90% now. Thank you for people who got over their fear of getting vaccinated, over their hesitancy, and now they're leading the state. And I just say a huge thank you. But nobody can predict, and we also don't know at the time of outbreak whether there were cases in the community we didn't know about, and other states will have the same challenges.
But you did know, that New South Wales Health did know on the 24th that there were several cases in the community, several attendees of the West Hoxton party in the community that they hadn't been aware of. Are you saying that it wasn't until the 26th, just hours before you called the citywide lockdown, that they advised you that they'd failed to control that outbreak, that information that they knew on the 24th?
As I said, we have and I can't say this more proudly, criticise governments, but our public health officials are the best in the land. And the fact that we managed to keep the virus as suppressed as we did, especially around the 200 case mark, I look back now and think we did remarkably well to suppress the virus at certain numbers along the way with a largely unvaccinated population. I'm hopeful that the higher vaccination rates will start kicking in, but I will not for a second say anything except extend my deepest admiration for people who are literally working 24/7, non-stop. And Dr. Jeremy is one of them, Dr. Chance another one, but they've got a great team behind them. And I asked Danielle in the lift on the way down whether she was doing extra shifts, and she said she was, and all her friends were. These are people who are stepping up with their skills that none of us have, and their advice is critical to government decision making, and their advice is what government bases our decisions on. Last question.
Just very quickly.
Last question. Yeah.
So when are you going to start mandating the vaccine for your politicians? The Deputy Premier seems to be all for it this morning.
Oh, look, we've had conversations. I think all of us, I personally don't want to go into a workplace or a venue where there's unvaccinated people. That's just my personal choice. And I understand I know at least, I can't speak for the upper house, but I know for the lower house, the committee that looks at these matters is actually looking at this issue about what is the policy in anticipation of Parliament going back on the 12th of October. So I hope that all workplaces will encourage all of their employees to be vaccinated. That is my strong preference, and I hope that's the decision the presiding officers come to. Thanks, everybody. Thank you.